For those who knows me, good morning. And for those who don't know me, my name is Dr. Angelov, and we are here today to have fun, a lot of fun. And medicine's supposed to be fun, and health supposed to be fun. So we'll start with a little game, okay, to get a little bit closer to each other and understand that we are kind of one big family instead of separate people who are running around and doing something that nobody knows what. So the game is very simple. It's like hippodrome. Usually when the horses are racing, and I'll say that horses are racing, and you'll go like this. Everybody, go like this, right? And sometimes horses are going through the grass, so you go like this, right? And then sometimes horses have these barriers, so they have to jump. So you go. And sometimes it's a double jump, right? So you go. And sometimes horses are turning right, right? Turning right. So you go right, not left, right. And then horses are turning left. And then you go with the audience, and we have ladies, right? And ladies will be doing like, go, 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 go. Yeah, you can do it. Go, 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 right? Everybody go, 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 go. It's not just man or woman. Everybody will do the same thing. So ladies, go, 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 go. Man will do what? Yeah. Oh, yeah. Okay. And then the kids, what usually kids do? They go, yeah. So it's for everyone. It's not just for watching this. It's for participating in this. So how the kids are doing? They're doing like, woo! Don't be shy. And then you have what? You have cobblestone bridge. And when horses are going through cobblestone bridge, you go like, ooh. All right. So, and then sometimes you have commercials, right? And when we have commercials, usually in this game, they go like, always Coca-Cola, right? But in our audience, nobody drinks Coca-Cola, right? No. So, but today, we're lucky that we have treat after the event. We'll have a little taste of great organic cafe, which is Life Alive. So we'll be testing the real food after all. So instead of Coca-Cola, we'll go Life Alive. Right? Let's go all together. Life Alive. Okay. So let's start this game. So first, horses are running. And then they turning left. And then they turning right. And then they go the woman. Go, 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 go. And then running again. And then they go through the barrier. Whoop. And then go to double barrier. Whoop. Whoop. And then go left. And then we have man. Oh, yeah. And then we go again. And then grass. Have grass. And then go again. And then we have this commercial, Life Alive. And then we go further and turn left, turn right, double barrier. And we're there. Okay. So this is what should be in a medicine instead of what we have today. So we'll start to understand that today we live in the state of fear. And this is what drives us today. We are in fear of leave life. We are in fear that we'll have disease, incurable disease. We are afraid that we will not have enough of coverage, that tomorrow nothing good will happen. Then we're afraid to get to the nursing home. And then we're afraid to suffer. And then we're afraid to die. And this is where we live. Why it's so? Who needs it? The system. The system needs it. Why? Because they thrive on keeping us all together in a state of fear. So for the system, we are just, oops, I'm sorry, just a second. It's a little glitch. Okay, we'll start again without game. Okay, so for the system, we are just source of making money. And that is why we have to stay the way we stay. And the main common denominator in everything is that we are very separate. We're not united. We don't help each other. We try to be pushed away. We have huge difference and huge distance between doctors and patients, between doctors and nurses, between doctors and doctors, patients and patients. So we are so separate, and it's very easy for the system to keep us the way the system keeps us. So basically, we have several sources that keeps us the way that we stay in a state of fear. If you see, it's M&M, it's media and medical society. So you go to the doctor, and what's good you can expect? Usually, you have some kind of diagnosis or some kind of label that you stay with, and this diagnosis will be something detrimental that it will be very difficult to cure or anything. So this system that we were talking about, it thrives on the paradigm that disease is permanent and the health is temporary. So instead of saying that I have like life, I have a disease and I have remission. And I'm surviving. I'm the cancer survivor. I'm, back surgery survivor. I'm survivor all the time. So this is the paradigm that we have today. And of course, in 50 years, we produce a lot of disease productive industry, which is food and entertainment, that keeps us sick, stable in our chair, and the only physical exercises that we have is flushing the channels. And this is Obamacare. Welcome. So it's very easy to read, uncomplicated, understanding what Obamacare is all about. So basically, this system doesn't really help much to understand where we need to be. And with all of this system, we get sicker and sicker. And of course, with all of this that I was talking about, we have no future for us, we have no future for our children, and we have no future for our grandchildren. So what we have to do, we cannot wait from the administration to change something, because anything that anyone will change will be to their advantage, not to make you better, happier. That is why we have to change from beneath, from inside. And we have to restore a good and right relationship between physician and the patient. So what we have right now, we have like a ship, Titanic. I was talking to insurance company, to Tufts Insurance Company, and it took me a long time to get to the right person to talk about different type of coverage, different type of medicine. And I got to the CEO of the company, who is the medical director of the Tufts. He was listening to me, and then he said that, you know, it sounds great. It's like utopia. It's great what you are proposing, but you have to understand that the Tufts Insurance Company is like Titanic. If you want to turn it half a degree, you have to get a lot of power to make it happen. And I said, you don't understand. I don't want to turn to Titanic. I don't want to touch it. What I need a little safe boat for my patients. So if I have this safe boat for my patients, let it sink. And the system is not capable to survive because it's based on greed and based on separation and based on the fact that you have to be in control of the patients. You have to be in control of everything that you do. So we have kind of two sides of the story. One side of the story where we have increasing cost, and insurance company are doing whatever they have to do to get the cost up. We have emergency room that you really don't want to go anymore because it's not a safe place to be. They will do a lot of tests. They would probably examine you, but they will not give you a diagnosis and they won't give you a treatment. And it's unfortunate, but this is what it is. And we have now insurance marketplace where will be very interesting thing where you go to this insurance exchange and you have no idea what you're buying and what's good, what's bad. And basically everything is bad there. So what I would like to do, I would like to cross you over and get you to the bright side of the life, where it's a different paradigm, that the health is permanent and the disease is not really disease. It's a temporary condition that we got because we did something wrong to our body. Our body is very, very wise mechanism of survival. So if we abuse our body, bodies start to scream at us, and we don't hear it. And bodies scream more and more until we have symptoms and more symptoms. So usually when you go to the conventional practice physician, what do? They mask the symptoms, they close the ears and say, you know, you can scream whatever you want, I have good earpieces, so you don't hear anything. And this is what we do. So what do we want at the end of the day? We want to be healthy, right? We want to have security in our life. We want to be interdependent, that we know that at any time we can be helped, and we want to be happy. With economy that is going downhill, and it doesn't make any difference what the Wall Street is saying, it doesn't matter what the media is saying, the economy is going down the hill. And I'm repeating over and over again. So you have two things that you can invest today that tomorrow you'll survive in any circumstances. It's not your gold, it's not your silver, it's not your real estate. It's your health and your relationships. If you have good relationships with your family, if you have good relationship with your friends, if you have network of people who you can rely on, then you'll be okay. And the health is predominantly very important things to survive. And what is the insurance today? We buy insurance to get sick, basically. We don't buy insurance to get healthier. And for people like you and me who try to stay healthy as much as we can, we don't have insurance. We are paying for people who don't care for themselves, and they just use this insurance left and right and abuse this insurance. In this insurance that we have today, like a Swiss cheese, we have a lot of holes. We have copayments, we have deductible, certain things are not covering. I have insurance, I had insurance, I stopped it. I had insurance and I pay $1,000, and then I need to go to the doctor, and the first thing that I realized that I need to pay out of pocket first $250. So I pay $1,000 on the top of everything. I have to pay another $250. Why do I have to pay? So I don't use it. So basically, insurance company today are selling you something that you will never use. It's just catastrophic insurance, but the cost of this insurance is very high. And it will be even worse in 2014, where the premium of this insurance will increase, and we will get to the point that we will not be able to afford it. So what is the choice that we have? At least me. So today, I have 4 choices getting into the system that we are in. The first one is early retirement. Because to sustain in the system that we have, it's practically impossible. Remember the Obamacare? The administrative part of the coverage is so huge. It's just enormous. The second thing that I can do is get into medical house. I close my practice and I go to medical house where I will be doctor number 17 in a huge practice, which will be, they already have like 2 of them in North Shore, and they are building it as we speak. It's a huge place where you have a lot of people who are taking care of the patients, and it's like one patient will be seen by nurse assistant, and then nurse practitioner, and then physician, and then nurse practitioner, and another nurse, and another administrator, and another person. So it will be like great care, but physician will be able to see up to 30 patients per hour. 30 patients per hour. I really don't want to go there. I don't want you to be there. We have different understanding how the relationship between doctor and the patient should be. The third one is concierge medicine, which I think is very unethical. So what concierge medicine is all about is I have my office, I have 2 members of staff. I have to get another 3 members of staff to deal with the bureaucratic work and stuff like that. So I have to get some kind of income on the top of whatever I have from insurance company. So I'll start charging patients in addition to whatever insurance company will pay, another $3,000 or $6,000. And these concierge offices are rising like mushrooms in Brookline, in Newton, in different places in the United States. And I really don't think that it's right to go this realm. So I was breaking my head and understanding of how better I can serve you and how better we can live our life. And I come up with a new, affordable model of system of integral health. And I'll talk about that a little bit. So this slide basically talks to itself. I don't want you to pay me to think that you're buying me or my time. I'm not for sale and you're not for sale. Insurance companies think that we're all for sale, but we're not. We're free people and we want to live free, healthy life. You will belong to the club, great club. So it will be a healthy club where you can get understanding of what health is all about and how to stay healthy, and not only stay healthy, but promote health to other people. And of course, you know that I practice almost 20 years in Swampscott, and I have great deal of pleasure seeing you in a waiting room, in exam room, and someplace else. And we have like a great relationship, and I think that my patients is my extended family, and this is how I feel. And of course, you were so wonderful for all of these years, so I cannot even think of losing you when I go from one entity to another entity. We'll have to somehow figure it out the way how we can survive and we can go further. So it will be two kind of plans. It will be Platinum Club, which will include all of the above. Human relationship between patient and doctor, my personal involvement in your care, including advocating for you whenever you go. When my mom and dad was alive, I wasn't their primary care, but yet, when they go to the hospital, I was on top of the game. I try to make sure that everything is done right, and I was contacting with the physicians and nurses and trying to make sure that everything is going by the plan. So the same thing I will do with you, and of course you know that for some of you already did it. It will be another element that I didn't see anywhere yet, but it will be a lot of fun. So we'll have this thing, group workshops. So instead of treating diabetes one-to-one, will be workshops, and we'll have integral education that will bring you to the healthier state. And it will be very fun, a lot of games. And the main thing there is that we are lack of motivation. If we don't have motivation to do something, we cannot move forward. If we have group of support, and you know that AA was on the market for a long period of time, and it proved over and over and over again that only with the connection, only with the tight relationships between each other, you can survive, and you can do whatever you have to do. So this is exactly what we'll try to do in small groups, and then we'll go further and we'll expand. The same thing goes with the high blood pressure and diabetes. It's very difficult to, say no to a piece of cake or, something salty that will bring your sugar or blood pressure up. And of course, you have to exercise, and it's very difficult. We'll do cooking classes. And I hope that the BEFCOM, that I really, really appreciate that they hosted us today, and Beverly High School give us this wonderful air-conditioned place where hell outside and this heaven inside. So I really appreciate the effort of BEFCOM. This is the best public television on the North Shore and in Boston and probably in the entire world. So we'll be doing cooking classes here, and the cooking classes will be done not by the top chefs. I try to connect with the top chefs. They're so full of themselves. So they think that they know everything and they can do everything, but one of them just told me that he can do healthy meal for 5 minutes without anything fancy. So he'll just use microwave. In 5 minutes, he'll do healthy food. So after that, I said, okay, we'll just stay away from healthy food. So what I think, you have enough of expertise, each of you. And we'll share our recipes, we'll share our experience, and we'll find out the way how we can find healthy food, how we can prepare this healthy food, and how it will be beneficial for everyone. And so it will be a little bit of competition, so you'll get ready to get your steam up, and you will be cooking. Probably we'll find a place where you'll be cooking, but we'll be taping it for everyone. Health education. This is a big one. Unfortunately, today, several of the key people of health education, the chiropractors, are not here. But we have here in this audience a lot of health educators, right? Raise your hands. Who are the health educators? Yes. So we have a lot of people who can share with us wisdom of health, happiness, connection, and feeling of love. And then, of course, quick access, it's nothing new. I can accommodate everyone in a day or two, depends on the severity of the problem. House call, this is something new. When I have everything covered, I want to go back to routine. I want to go back to what physician is all about. I want to do house calls. But to do house calls with insurance companies where they restricted you for everything, and you have to jump through the loops to get there and get like $30 going like half an hour one way, half an hour another way, trying to park there, trying to get, so it's not cost effective. But if I have with the membership, if I have my basic needs covered, I will start doing house call. I did in the past, and it's lovely. Emergency visits, minor surgeries, it's not a problem. You don't have to go to the specialists, and you don't have to go to the dermatologist sometimes, because, recently I had this one lady, poor lady. She is 82, 83 years old, and she has skin cancer. And the skin cancer is very benign. It's squamous cell carcinoma. Nobody dies from this cancer. It doesn't spread through the body. It doesn't kill anyone anywhere. I didn't read anything in the statistic that it kills something. So she went to the dermatologist, and dermatologist, like a monster, scare her to death that her eye will bulging, and her liver will be dropping down, and so she'll be dying a terrible death. So she has to go to the Mohs surgery. And Mohs surgery is something very interesting. For this benign thing, they will cut out, and then they will go and look at under microscope, and they will see if the margin is still cancerous, so they will go back and cut a little bit more. and cut a little bit more. So after wall, you have big hole on your cheek, and you have $5,000 bill, and you have to have general anesthesia, and everybody's happy. So sometimes it's not necessary, but the system, remember this monster who is eating everything and producing money? This is the system. Physicals, it will be new style physicals. You would love it. Usually when you go for physicals, what do you expect? You expect that your blood work will find something bad and doctor will say, okay, you're terminally ill. Or you have to go for x-ray or colonoscopy, and colonoscopy will find polyp. Oh my God, you have a polyp. So everything is very scary. But this new type of physical will be on a picnic. So it will be picnic of all of our patients. We'll rent the place, we'll go all together in a tent, and we'll have fun. We'll have a lot of games, we'll have a lot of interactions, we'll enjoy the nature. And then, by the way, I could see one by one while everybody else will enjoy the nature. And not to find something bad in you, but probably guide you and answer all your questions. And this is physical is all about, is whenever for the year you have any questions that has to be answered, this is physical for. It's not to find something bad in you. Then wholesale price for the medications, x-ray, ultrasound, and all of this. I'll give you an example. The ultrasound, abdominal ultrasound, cost about $800 in a hospital. Copayment, no, not copayment, deductible is $500. I found the place that will do the same ultrasound with the same quality for $150 if you drive to Newton. And if you want to have this ultrasound done in your place, it will be $200. So, and how many ultrasounds you need anywhere? So what is the Gold Club? Gold Club is something different. When people come aboard first time and they have no understanding of what this disease is all about, a lot of people still have this delusion that diabetes is, incurable disease, and hypertension is incurable disease, and it basically needs to have a lot of education, a lot of follow-ups, a lot of things that has to be done. So it's a little bit more work to do, but the goal is to get these people from Gold Club to Platinum Club to maintenance, to have everybody happy and healthy. And so this is and of course the Gold Club will have the whole benefit of Platinum Club plus a little bit extra. A disclaimer. This is a very important thing that we have to do. We'll have to sign contract between patients and physician. And it has three different things there. One is commitment. People who want to really take care of themselves have to commit. I didn't take it out of air. I adapted from the first HMO rules, and this first HMO happened to be 3,500 years ago. It was in China, where the medicine man was going from one place to another place. Outside of the house, it was the vase. He would reach into this vase, and if the coin is there, it means that everybody is healthy, so he doesn't have to come there. He just collect this money and go further. But if coin is not there, he has to go and treat in his own expense, at his own time, and he puts a lot of his own effort. Two things there. One, in the morning and in the evening, it was Tai Chi sessions. The whole village will go and have Tai Chi session, right? You didn't come to this Tai Chi session 3 times, you're out of HMO. You're not compliant. So you can take your vase outside, inside of the house, you're done. The second thing is that if you have any problems, so the medicine man could go into your house and check what's wrong there. And if he is trying to guide you what has to be done, and he had all access to the houses, he would come at any time, and if he sees that nothing has changed, out of HMO. So basically, it takes 2 to tango. I cannot help patients if patients don't want to be compliant. And this is the main thing. So this is one disclaimer. Another disclaimer is standard of care. Standard of care is a very unique thing. It's for lawsuits. And usually people compare in the court, they compare practice of one physician to another physician. So I don't do things that usually physicians who are in American Medical Association and American Family Practice Association are doing by guidelines. I do things differently. I'll give you an example. Several weeks ago, I get a call from mom who had newborn. And she said that the child is spitting blood. So it's 2 days old, spitting blood. What is the standard of care in this instant? Sent to emergency room, right? Off my back. What did I do? I said, come to my office, even though it was Saturday. I said, come to my office, I'll examine the baby. I examined the baby. I didn't find anything alarming, anything really bad. So I told her what has to be done, what it's approximately can be the reason for this. And then she called me in 12 hours again. That is again incident that baby threw up, and it's already was like a brown clot. So I said, go to my office, I'll meet you in 15 minutes. I saw the baby. What happened was that it was very dry, so the baby was bleeding from his nose, and of course he was swallowing everything. And, the brown clot for me was like relief. I knew that it's last thing, so I look in the nose, I see this broken vessel, and I know that everything will be okay. And week later, I examined the baby again, and so we follow up. It's already, this incident is over, but it's not standard of care. It's not what usually people do in conventional medicine. So I want you to be aware that my standard of care is totally different from standard of care of conventional medicine. I really don't want to protect my back from you. I want to have your trust, and I want to have a good relationships. And if anybody have any problems with me, just bring it up, and we'll decide, and we'll resolve it. It's not a problem. But I really don't want to go back and to play defensive medicine. And the last one is specialists. As you probably know, I was surgeon for 10 years back in Russia, and I understand the specialty in surgery because it's very precise work that has to be done. If somebody operates on the shoulder 3 times a week for 5 years, and a professor who operates everything, and once a month or once a year operate on the shoulder, I would go to the person who operates on the shoulder every single day or 3 times a week, because it's like it's a handwork. In terms of the internal medicine, I really don't understand how you can have specialists for one organ of one system, because the human being is the human being. You know, you cannot take the heart and liver separately and just treat liver without understanding of what is going on with the whole body. And sometimes when I see people coming to specialists having like 5 pills, and then these pills will give some kind of side effects, and we'll go to another specialist, and we'll give another 5 pills, and before you know, it's a snowball. And I really don't want to be responsible if it's your decision to go on your own to the specialist to think that they will help you better. I have no problem to send to specialists, but before you go to specialist, please consult me, and we'll talk about that. For example, if you have problems with the stomach and you need to have gastroscopy, of course you have to go to the gastroenterologist or surgeon. If you need colonoscopy, of course you have to go to the specialist. If you have arrhythmia, of course you have to go to the specialist. But it's not lightly taken the same way as I'm not lightly giving antibiotics or anything else. So this will be in place. The best thing of all, we have to grow health-oriented community. And we have to welcome new people in our community. And we have to have network between people who are in this, it's not industry, but in this field of healing, health, and happiness. So instead of being in this poison environment where you have fear, we have to get away from it and create our own environment where we'll be promoting happiness, connection, health, and with fun, with a lot of fun. We have a lot of different ways how we can do this with the games and the interactions and the round tables. And we have a lot of tools, so we have to just be willing to do this, to understand that this is much better for us, emotionally, mentally, and then finally physically. Yes, I already told about educators. All right, so what we need to put effort to make aware of insurance companies that there a different way to make the relationship between physician and the patient healthier, better, happier, and to be like one unit, like one family. And I need your help there. I call a lot of insurance companies. I have talked to a lot of insurance companies. One that I will be sitting and signing the contract next Wednesday. It took me 9 months. I was pregnant for 9 months. I'm delivering. So the one insurance company took it. Do we have anyone who has neighborhood plan? Okay. So for those who have neighborhood plan, I would give telephone number of the lady who ignored me for a long time, and I would ask you to call this lady every single day, asking to accept Dr. Angelov's proposal, right? So it takes two to tango, and also a long time ago I had this radio show about holistic medicine, and one of the guests in this show was the person from Blue Cross Blue Shield. And it was very intriguing for me, how come they cover something holistic and they don't cover something else? And I asked her, what is the path in a mind? How do you make your decision? What has to be covered, what's not? And she said that there are two ways. One is the peer review. So something appears in the New England Journal of Medicine, which this one will never appears there. And the second one, pressure from the patients. So a lot of patients pressured to cover acupuncture because it was helpful, and then Blue Cross Blue Shield start to cover. So I need your help. Whatever insurance you have, just call your representative and we'll go together. I'll be doing my job from one side, you'll be doing from your side. And what exactly do we need? This is how the system works today. This is the patient. Sometimes if you have Medicaid, Medicare, government pays for people, or the company pays for people. So part of the money will go from company or from government, and part of money will go from the patient. It will go like premium to insurance companies. And then I would see the patient, insurance company, I claim that I saw the patient, and insurance company will pay me whatever they want, whenever they want. With this system, my incentive to see patients as often as possible, because this is how I make my money. I have to make you sick. I have to make sure that you understand that you're sick and you have to come to me over and over and over again to make my money. And I don't like it. So the system that we have to implement is totally different. Patients will pay the membership. And this membership will go to me to cover my expenses. The payer and patient will pay to insurance company, but instead of, I will not charge insurance company, but instead insurance company will pay back patient to reimburse for the membership. So this way, everybody is happy. Insurance company will have premium minus little thing. You'll be happy because you will not take anything out of your pocket. And I'll be happy because I will not have all this nonsense from insurance company that I have to deal with. So everybody's supposed to be happy, but it takes a lot of work from both of us to push it through. For now, most likely, it's not work. It will not work. It will take some time for both of us to make it happen, but this is what we have to do. And yes, if any one of you are owner of the company, and I know that today is supposed to be several owners of the companies who are supposed to buy insurances for the people, let's get together and think how we can implement the new thing that's path to, oh, it's end of show. Path of wellness program that we will implement. And with all of this, we'll be able to create something that will be profitable for everyone, will be great for everyone. I don't see the slide about the cost, but for Platinum Club, for now, the cost for one person is $100 per month. If you think about it, it's like a cup of coffee a day. And for the family, doesn't matter, it's family of 2 or family of 10, it's $200. And the Golden Club is $200 for the person, but it has to be a very short period of time, and I would make sure that I will kick this person to the platinum level as soon as I can. And this is what we'll do. So what I would like you to take today home is the message that we live enough in a state of fear. we live enough in the state of separation. We got it. We didn't like it, and we want to have something better. We want to go to the other side of the street where we're all helping each other, where we're all trying to be like a one big family, where we're creating the level of light and level of love and level of kind of community. And this is exactly what we need to do. And we have a lot of resources to help each other. To finish it up, I want to play another game. It's the game of the traffic light. You know, in traffic light, you have 3 colors, right? It's what? Red, yellow, and green. So I would like to see how we can synchronize together, right? I will count 1, 2, 3, and everybody will say one color, right? And we'll see how we can synchronize to the point that we feel each other, that we'll yell one light, okay? And it's 1, and 2, and 3. Green. Okay, we'll do it again. And 1, and 2, and 3. Yellow. Whoa. And again. 1, and 2, and 3. Yeah. Another one. 1, 2, 3. Red. Almost. It became orange. And so thank you very much for being here. Thank you very much to give me the joy to serve you for so many years. And I hope that it will be in the future. And we'll create something beautiful and nice in the future to build it together. Thank you.